Hi, this is the evidence-based debate for Group 2, our counter-argument to Group's 1 topic. Homeopathic products should be carried in the retail pharmacy setting and should be recommended by pharmacists as a supplement to conventional medical care. And these are the group's participants. Our claim for counter-argument, Groups 1 claim that homeopathic medications should be still allowed to be sold at retail locations is not factually supported. We claim that if Group 1 states many patients may want to be autonomous and treat their ailments with an individualized holistic approach by utilizing the guidance of a physician or pharmacist, such actions should be detrimental to the patient's safety and well-being. If we as healthcare providers succumb to this public peer pressure without evidence-based backing of these claims, we put public at significant risk for adverse reactions or ineffective therapy. In a study published in JAMA in 2009, the authors wondered, why do we worry about a rare side effect from a drug which has proven efficacy, yet accept homeopathic products? So the risks far outweigh the benefits of homeopathic remedies, warranting the removal from the market. Homeopathic preparations, as stated by the article, have inconsistent dosing, unknown toxicities, serious drug interactions, and no known proven safety or efficacy. So, in also the statement that the right of patient's autonomy, many patients would want to try different therapies other than the conventional treatment. First, we would like to define homeopathy, which is the treatment of disease by minute doses of natural substance that in a healthy person would produce symptoms of disease. It's based on the belief that the body can cure itself. So we are discussing the data presented by Group 1. First, in the argument placed by Group 1, the Grimm study is allegedly supporting the use of homeopathic products such as Ignacia and is a reason the pharmacist should also support the use of such products. The Grimm study reported a decrease in the duration of cold in patients treated with Ignacia over those treated with placebo, yet the study limitations include small sample size, patient grouping and randomization was in question. Also the alcohol content, which is up to 20% of alcohol in both drug interventions, which could also be affecting the results of their studies. Furthermore, Ignacia purpurea was used in homeopathy to treat diphtheria and other infectious and other fevers. So the concern now with homeopathy is not just reducing the length of the treatment, but also worrying about treatment of fever or diphtheria, leading the patient to believe or misleading patients that these disease could be treated by homeopathic products rather than the evidence-based vaccines. An additional flaw in Group 1's rationale is a statement that kava is a product used to treat anxiety. We do not recommend kava as a treatment for anxiety based on reports from the there was a case report about a 60-year-old female who was using kava and developed hepatotoxicity and liver failure that led to death. Also, Anxiety and Depression Association of America recommended kava be avoided, especially in patients with liver problems, until rigorous safety studies are conducted. In addition, the FDA has issued an advisory warning consumers that kava-containing products have been associated with liver-related injuries, including hepatitis, cirrhosis, and liver failure. Our warrant: homeopathic products should be recommended by pharmacists and as a supplement to conventional medical care. Well, our warrant is that according to a study published in 2014, the authors have stated that homeopathic products are used to treat symptoms rather than treating underlying cause. They are not subject to regulations. The clinical trials have failed to explain their mechanism of action and pharmacodynamics, and they are dispensed because of high public or market demand or publicity. So authors have recommended that pharmacists should follow codes of ethics and provide succinct information when dispensing homeopathic products, yet this is not applicable since there are no valid evidence-based studies with sufficient data. Furthermore, a warrant to this statement is that according to an article in the pharmaceutical journals in 2018, a better service for pharmacists to provide their patients, instead of opening communication lines about alternatives to conventional treatment, it's perhaps not to sell the homeopathic remedies at all. The author has mentioned that, like the sale of cigarettes in US pharmacies, homeopathy threatens to fatally damage the reputation of community pharmacy. If the pharmacists fail to clearly inform customers that homeopathic remedies are no more effective than placebo, we have acted unethically. We're still discussing the argument of group 1 by further warrant. Sample size, small sample size lead to inaccurate reporting of clinical data. In the National Health Interview Survey in 2012, where an estimated 5 million adults and 1 million children have reported to use homeopathic medication, if you compare the population that uses homeopathy versus the sample size in the study or the survey conducted on the safety and effectiveness of the homeopathy, we will see that the sample size is too small to be seriously considered a true representation of the real results. Further, the non-standardization of the production process. Diluting a homeopathic medication, we can conclude that it fails to indicate to the patient if the remedy is therapeutic, subtherapeutic, or even toxic, thereby bringing into question, are these products over or under diluted to be considered effective? Herbal products and homeopathic products are both natural, but differ when it comes to how they are made, their safety profile, and what their indication to be used. Thus, homeopathic products should be only prescribed and prepared by homeopath practitioner. So one qualifier here, for group 1, they included 2 studies where the use of homeopathy could be used in conjunction with conventional therapy. The first study was a single-blinded randomized trial where the homeopathy was used to restore vital energy balance of a patient, allowing the body to heal itself, in addition to the conventional chronic periodontal treatment. Yet the study limitation was a sample size. They only included 60 patients or participants in the trial. In the second study, where they have pointed out that the benefit of consultation intervention helps with the conventional rheumatoid arthritis therapy. Again, the sample size is a limitation, and there is a lack of significant difference in the primary outcome of the study. So this actually supports our argument. Homeopathic remedies cannot be a comparative or a replacement to the conventional therapy. So finally, we come to the rebuttal. From the studies provided, there is a significant lacking of vigorous testing, larger lacking of sample size to consider the clinical trials as evidence, minimal difference in duration of disease when treating homeopathy with a homeopathic preparation. And lastly, perhaps a homeopathic product can be used as an adjunctive therapy, but it hasn't been substantiated as monotherapy. Based on these, we conclude it would be in the public's best interest not to sell these products. And this is our reference slide. Thank you for your attention.